right, with all of that out of the way, I'll say welcome again. My name is Chris. I'm with Tampa Hillsborough County Public Library, and we're excited to have you with us this evening for the program Becoming Your Own Patient Advocate. This program is part of our Libraries Build Communities initiative, and to find out more about that, you can go to the landing page, hcplc.org/librariesbuildcommunities. There you'll find some information about the initiative and also links to our YouTube recordings of previous sessions. All right, so now I would like to introduce our guest speaker this evening. We have Jessica Daly, who is a consumer health librarian at the Clifford E. Grace Community Health Library, pardon me. And how are you tonight, Jessica?
I am great, Chris. Thank you so much for allowing me to be with you and your online patrons out there.
Great. We are very pleased to have you with us. And I'm actually going to hand things over to Jessica. Let me give you presenter control so you can bring up your screen. All right. And I'm going to turn off my microphone and camera here. I can see the screen now, so everything looks great. If you need me, I'll be right here in the background, okay?
All right.
I forgot to mention, there is a PDF in the handout section that Jessica put together. It's some self-care resources, so feel free to download that while you're watching it. It'll also be available on the YouTube recording, but it's available now to download. All right, I will now hand it over to you, Jessica.
All right, thank you so much, Chris. Well, let me go ahead and get started. We're going to talk about becoming your own patient advocate this evening, and this is really important, not only to your health, but also just to your overall well-being, your quality of life. And so knowing how to become that patient advocate for yourself really is key, and we're going to talk about that tonight. Also remember, in this short period of time we're together, we're going to kind of scratch the surface on this. So you'll have my contact info if you'd like to contact me afterwards for even more information. So this is me. You guys saw me online as well. And I'm a consumer health librarian for Orlando Health in Central Florida. And really what that means is I help patients and family caregivers find health information and do health research. So it's a really unique but exciting role. So what are our objectives in our time together? I like you to know up front, what do I want you to walk away with? First, I want you to improve your personal health literacy, and we're going to talk about what that means. I want to empower you to become active participants in your own health care. You are really the pilot of this ship or this plane. You're the one in charge of this, and we're going to talk about that tonight. And I want you also to improve your health and quality of life for family caregivers, because a lot of us are family caregivers. I am for my husband. And so you need to be careful and know how to ask the right questions and receive the right answers. And then I want to promote the role of hospital libraries in your care. Know that this is a resource that's free to the public to find out more about your health. And then we're going to discuss ways that you can receive valuable health information. So why do we become interested in our health? Well, these are some of the top reasons listed in surveys from patients. Number one, especially this time of year, we're trying to choose a healthy lifestyle. It could be preventative care. Maybe a loved one has been diagnosed with a disease or some type of diagnosis that's very alarming to you, and you've been encouraged to go and have preventative care and check into that. Pregnancy is a big one. I know for myself, that's when I really became interested in my personal health. Noticeable changes in your health. Let me just say, be transparent. I'm 47. Things are changing in my body and in my lifestyle. So when I notice changes, I am apt to look into that, but also to seek care from my general practitioner and get their guidance on what to do. Injury or accident. This is when a lot of people become very concerned with their health. And then the last and probably the most used is diagnosis of disease or illness. So we don't know a lot about an illness until we're diagnosed. And then it's important for us to learn as much as we can. Well, why do we research? Well, here's a few things that you may research. Medical tests. Maybe your physician has said, we're going to order you an MRI, and you're thinking, what is that? What does that look like? You can look into that. Maybe to learn more about your diagnosis. Maybe you'd like to get a second opinion. I highly encourage a second opinion, especially if it's something that is very serious or, involves a treatment or medications, things like that, or especially surgery. Understanding your medications, not only prescriptions, but also over the counter and healthy alternatives like herbal treatments or all natural. They're still medications. And so we want to make sure we know all about each one and also their interactions. And then side effects. Do we understand what to expect when we take a certain medication or we have a certain treatment? That's really important for us to understand. And then share changes in your health or life. So this is something that I really encourage you to do with your physician and your medical team. Share any changes, emotional, mental, physical, anything that has happened to you since you've seen them. It's very important for you to be open about these changes. So here we are. How do we become our own patient advocate? Well, here's the biggest thing. You want to be and need to be an active participant in your health care. You need to understand everything there is about your diagnosis, your medication, your treatment, and also the risks and benefits from doing different things. It also means that you can ask questions. You should be able to ask a question of anyone that has a part in your healthcare journey. That could begin with the receptionist all the way to the physician. And that way you can make well-informed decisions about your own health. That's so critical. So there's a couple things I want to share with you today, and we are recording this, so don't feel like you have to jot all this down. But these are just some top things I think are important for us as we become our own patient advocate or our spokesperson when it comes to our health. First, we need to understand our health insurance and how it works. Let me be the first to say it is so overwhelming and so complicated. But let me also warn that let's say you've been with the same company for years and you have the same health insurance. Still refresh yourself each year on it because things change. I often speak with people that share, I didn't know that wasn't covered anymore, or I didn't know my deductible had doubled, or I didn't know there was a copay. So knowing these things really will help you just really keep from having that shock or that confusion later on down the line. Understand what's covered and what's not. Then ask questions. I just said this, but I'm going to say it again, of anyone who is part of your healthcare team. And guess what else you can do? You can ask the same question to each member of the team and see what their response is. The next one is really something near and dear to my heart because as a caregiver for a spouse who has health issues, I have been kind of in charge, so to speak, and I've been a health advocate for my husband. So I think it's important to keep personal notes and medical records organized. I know a lot of things are online now in what's called patient portals, but all of us aren't technologically savvy. I will tell you that is a weakness for me. My husband loves his patient portal. Me, I still love something printed out to look at and read. So it really does determine, you'll determine which is best for you. But keeping personal notes is important. You can do it on your phone or you can do it in a notebook. I kind of like the old school style in a notebook. But before I go to appointments, I write down things that I have questions about so that I don't forget once I get to the appointment. And then I jot down notes about what the nurse or the physician or anyone on my healthcare team may say during our time together. That way I can look back, do some research, ask some follow-up questions. And then I know I mentioned it, but I'm going to say it again. Ask for a second opinion with confidence. You are not offending your physician, surgeon, your specialist. You really are not if you ask for a second opinion. And let me give this warning. If a physician ever acts upset or insulted or discourages you from getting a second opinion, I would run. That is not a good sign. Every physician and surgeon that I've ever dealt with that I ask for a second opinion, they welcome that. And they even tell me that they get a second opinion when it's their own health or their family. So it really is a good idea. Next, I want you to communicate your own health priorities and concerns. What does that mean? I want you to tell your healthcare team what you like, what you dislike, what frightens you. If you have a severe fear of needles, it is important that you share that with your team. There are things they can do to prepare you to deal with that. So it really is important for you to share with them what heightens your stress, what causes you anxiety. That way, they are aware and they can also maybe better explain what's coming down the line, what's happening next. Let me just share a personal note here. I have a physician that when I have any procedures, any checkups, anything, she is very aware and she tells me each thing she's about to do to me and each thing that's going to happen. And I just feel like we're more in sync during that appointment and there's no surprises for me. The next is know your health risks and how to manage them. Okay, here's the thing. We don't like to hear the negative side of things. We don't like to know what could go wrong or what could make us feel bad. But guys, it's so important for us to know these things. Let me give you an example. I talk to emergency room nurses and physicians all the time that tell me patients come in because they didn't understand this was a normal side effect from this drug or this treatment. And so you really could keep yourself from having an unwanted emergency room visit if you understand those risks and how to manage them. At the same time, when in doubt, go to the ED. I tell people all the time, the worst that can happen is really the best. They tell you you're fine and you go home. So I don't say don't go, but I also say know what to expect. And that could keep you from being in a very fearful situation that's unneeded. And then understand and know your treatment plan. Understand how to follow what your medical team needs you to do. Ask, why do I need to do this? When do I need to do it? When should I call you? When should I go to the emergency room? Ask these questions so that you fully understand what to do on your own and what is going to be happening next. That is just really important. So let me just say, whenever we know more, it alleviates the fear because the unknown is very fearful. So when we know what to expect, even if it's bad, so let's say I start taking a new medication and all of a sudden I have a terrible headache. And I read on the medication that one of the side effects, the normal side effects, at first is a headache. Then I don't panic. Then I know, okay, this isn't pleasant, but this is okay. It's expected. All right, this goes into the next topic. Discuss all your medications that you're prescribed and the side effects with your physician. It's really important for you to say, I've felt very fatigued, or I do not feel good after I take this medication, because normally there are tons of medications used for the same situation. So let's say you have high blood pressure and you start taking a medication that makes you feel really bad. Let your physician know, because there are so many different medications out there that you could take instead. But if they don't know to help you. The other thing is, make sure that you're taking the medication at the right time of day. Often we find patients taking a medication in the morning that's really better at bedtime because it does cause fatigue. So look at all those things. Do you take it with food? Do you take it with water? So these are important things to talk with your physician about. And then I get a little negative feedback about this next one sometimes, but I don't care. I still share it. Bring a friend or a family member with you to appointments. This is not an age thing. I hear people say, Jessica, I'm 35. I don't need someone to come with me to the doctor. Well, my husband was diagnosed with heart failure at the age of 28, a very overwhelming diagnosis and something that we have to live with the rest of our lives. We've been living with this 15 years. And we go to appointments together. Here's why. We've got two sets of eyes, two sets of ears, and things that I miss, he hears, or vice versa. It's so funny when we get in the car, we call it our debriefing, and we find out that we heard things the other one didn't or missed. So it's so important to bring someone with you. Well, what do I want you to avoid when you're searching for your own health information? I want you to avoid Google. People pay to be the first 5 to 10 sites that pop up. So it's not necessarily the best info, it's who paid the most money. Also, be careful of WebMD and other medical sites that have advertisements, because what we find is they're very biased. They give priority to groups and hospitals and systems that give them the most money. Be wary of drug company websites. They're always going to make the drug sound wonderful, but you need the good and the bad, what to expect with the drugs. And then television shows are very general. So understand that what you hear on Dr. Oz or the doctors, or even on the nightly news, may not actually pertain to your personal situation. So it's okay to talk with your physician about what you hear or you learn, but just be wary of that. And then the last one, other people's opinions and past experiences aren't always what's going to happen with you or what your journey entails. So be careful of that as well. So where do I want you to look online when you're searching for your healthcare needs? And it's called Medline Plus. So this is medlineplus.gov if you're looking this up online. It is a medical search engine created for patients and their families, and it's sponsored and updated by the U.S. National Library of Medicine. No advertisements here. It's going to direct you when you type in a topic. It could be anything from an infected cut, a bug bite, all the way to maybe a cancer diagnosis. So you can punch that in here and sites will come up that are credible and up to date and written and designed for the patient in mind. So this is a great site. You can also look up drugs and supplements. There are videos here, printouts. So it's a great source. And then the information you get here, then you can share that with your physician when you go for your next appointment. And I love this aspect of this website. It is 100% translated into Spanish. So everything you see in English on this site is translated into Spanish as well. So this is a great tool. I like to show people the versatility of this. I do get asked, Jessica, is there info in other languages? Because I get requests for everything from French, Chinese, Vietnamese, Haitian Creole. That is limited, but is available on certain like high volume topics. So topics that are looked up by lots of people or patients. So if that's your need, you can also always contact my library and we can look up information for you in the language that you need. Okay, so what do you look for when you're online and you're looking yourself? Well, here are some websites that are normally very safe. Hospitals, when you know it's a legitimate hospital. That could be the Mayo Clinic, or it could be, Duke University. I'm with Orlando Health. I could be Advent Health. So when you see these hospitals and you recognize them, that those sites are great. Universities also, like Duke University, have the example here. They train doctors and medical professionals. So medical universities would be a good source. And then national health associations like the American Heart Association, the American Cancer Association, those are always good. And they're usually very user-friendly for the patient and the family caregiver as well. And then I just talked to you and showed you medlineplus.gov. And also, these sites include videos, diagrams, and pictures and audio. So for a lot of patients, they request things in audio or video, and I totally understand that. I would rather have that format as well. So what are some subjects that most patients contact me and want to know more about? Well, here's my top list. Long-term illness is definitely the top, any type of disease, accident and trauma related injuries. But I also have requests for how do I relax? I want better nutrition in my life. I need info on medications. I need support as a caregiver, and then just encouragement along the way as a patient or a family caregiver, because as I say all the time, being sick isn't easy. And so, some people even say with chronic illness, I feel like it's my second job or my part-time job, keeping up with everything. So encouragement is also so important. Okay, so for additional information after this session, I encourage you to visit the Clifford E. Grace Community Health Library. You do not have to be an Orlando Health patient or family. This library is open to the public. And even during COVID-19 and everything going online, we've been able to reach people across the country. It's been really amazing. So you can come to our website, which is orlandohealth.com/library. You can call this number, 321-841-7234. And I'm also going to, give you my email. So if you'd like to contact me after this session, you are welcome to do that. So here is my email. So it's jessica.daly, and Daly is D-A-L-Y, at orlandohealth.com. And so just be aware that when you email me, it's really important to tell me what subject you need, any details that you can share with me, the more the better, so that I can be very specific when I research a topic for you. And this could also be for a family member. So feel free to reach out after this session. If you think of something this week, or there's something you'd like to look up or me to look up for you, I can definitely do that. All right. So I'm going to hand this back over to Chris.
Okay, let me go ahead. I'll take presenter control from you. All right. Well, thank you very much, Jessica. That was very helpful. Lots of useful information, and what a great resource that and information that you offer. This is fantastic. Now, if anybody has questions they want to ask, you can. This is the time to do it. This is our Q&A portion. So feel free to type your questions in the question section. And again, if you're watching on a tablet or a computer, just tap the question mark icon and you can submit that way. So let's see. It looks like we've got some questions here. Go ahead and drag this over so I can see it. Okay. All right, so this is about different types of tests. There's a lot of information that you offer on your website and in your library. Is there like a glossary of resources, or like articles about different types of tests so people can find out what they are and if they're all necessary?
Sure. So if you go to our site, we do have a lot of links there and information there that can guide you. But if you're having a specific test, you can feel free to just email me what that test is, or email the library. It'll go to me or one of our other librarians, and then that way they can actually send you specific info. And the other thing I like to do, Chris, is send them a video of someone having that test. So for instance, I had a patient a while back that needed radiation for cancer, but was very afraid, did not understand, and actually thought it was something completely different than what it was. And so when I sent her a few videos of people having the very same type of treatment, she said, "Oh my gosh, okay, I can do that. That's great." So any test or procedure, even like for ladies in October, I send videos so that they can see what having a mammogram's like. A lot of women are fearful and don't go have it because of that. So yeah, so we would love for them to reach out, just let us know what type of test or procedure they're having done, and we can send them some specifics on that.
Okay. I should mention to the audience in the chat section, if you can see it, I did post Jessica's email and phone number in there. Someone's asking about that. Also, if you didn't hear me at the top, there's also a PDF in the handout section that contains all of the information that Jessica's gone over, and has her contact information in there as well. Let's see, we got some more questions here. Someone is asking if there's information about how to find a physician beside through an insurance list. Do you offer any help with that?
I know that is tough because, that's one of the things that, just like with me being at Orlando Health and our health insurance, we really, to have our insurance cover it, have to go to Orlando Health Physicians, which isn't bad. I mean, we've got great ones. But it really, unfortunately, does start with making sure that it's a physician that your insurance covers. So, you know, is that ideal? No, it's not, but insurance kind of has us trapped in that area. So what I would do and what we've done in the past is we take the list and then we start doing some research online about each of these physicians. And the good part about it is there's a lot of websites out there, and if this person wants to email me, I can send them some specifics, but where they actually patients rank them. And so, you know, some you've got to understand might not be very fair, but you can read through that and know. And so
Right.
normally, like the physicians have a certain number of stars, but you can read the comments and just kind of get a feel for that physician. And the other thing I encourage people to do is actually just go and have a visit. You know, share with the receptionist, I'm looking a physician. I'd like to come in and just meet with the physician and see how the office works. You know, you're not dedicated to have to go to that physician. I hear people all the time say, I hate going to the doctor's office. And I'm like, are you fearful of it? And they're like, no, I don't like the front desk people and I don't like the nurse. And I'm like, then why are you going there? Like, there are so many places you can go. And it's just like everything else, Chris, it's a fit. It's not always the
Right.
doctor. You know, we've got to find that fit. And like for my husband and our primary, she's the third one that we've used in the last 5 years. Now we got her on year 2 here in Orlando and we're sticking with her. She's awesome. But we had to go to some others to see, they were good
Mhm.
doctors, but just wasn't a good fit.
Right, that's a good point. Yeah, like you don't have to settle on a provider. You know, there's more out there. So that's very helpful.
Yeah.
All right, let's see. We got a few more questions here. Someone's asking, okay, oh, there's there guidance or assistance or resources for anyone looking for help with possible uh, fraud or billing issues. Are there any sort of referrals or information regarding that?
Um, well, definitely that's something again, this person can give me an email because it might be that they can be a little more specific with what's going on.
Okay.
Normally, I would say start with the healthcare system, you know, with the billing department. And I will say, the squeaky wheel gets the oil. I mean,
Mhm.
that's just the way it is. Even for me, you know, I've been a caregiver for my husband 15 years, and sometimes I've had to call people 2 or 3 times a day for several days. And then finally, I think they think, oh, this lady's not going to go away. Let's help her. So, yeah, so I think you start with wherever the billing issue is. And then after that point, you know, you can't always put in a formal complaint with like the Florida. There's the Florida Physicians Association, and then you know, just like the Board of Health or that kind of thing. So definitely that person can email me if they'd like with more specifics, but I would definitely say start at the source first. And you can always ask for a manager as well, if you're not getting
Mhm.
anywhere with who you're talking to.
Okay, great. All right, let's see. We have time for a few more questions. I know you mentioned um, assistance for people needing information in other languages, and there's asking, does that include Spanish material? I'm assuming yes, but just to
Absolutely.
confirm.
Mhm.
All right.
In fact, I don't really know of anything I can't get folks in Spanish. That's probably the easiest, you know, along with English. So yeah, no problem at all.
Okay, someone's asking if this will be available as a webinar later, and yes, it will. It's going to be posted to our library's YouTube channel, and I just sent the address to that person. But okay, moving on. Let's see. We got a few more questions here. Oh, that's a good question. This is for individuals who might be either visually or have hearing impairment. Is there assistance available to them?
Absolutely. So what we've done in the past with visually impaired patients is made sure that we found them audio and video
Hmm.
with great audio. So we've done that multiple times. And then as far as we've also had blind patients. I actually worked with one just a few weeks ago. And so in that situation, I could email someone that works with her to read things to her. But I also, she wanted to know some info. And so I just gave her a call back and she recorded me sharing the health information with her. So we can definitely do that. We don't let any disability keep us from getting health information to you.
That's wonderful. All right, well, that's all the time that we have for questions. Jessica, thank you so much again for joining us. And you'll be joining us again next month on February 7th for another session called The Benefits of Sleep. So we invite you all to attend that. And to find out more about, let me go ahead and bring up my screen here so I can share some links with our audience. To contact the library, you can go online at hcplc.org/contact or call the number on the screen, 813-273-3652. While you're on our website, you can also submit your library story. Let us know how the library's helped you or how we've touched your life if possible. And also at the bottom here, you'll see there's a link to our calendar of events where you'll find the link to next month's session with Jessica. And that's at hcplc.org/events. All right, with that, I'll say thank you again to Jessica and to you all for, it was very useful information. We're very grateful for your time and for the job that you do to help others.
Thank you.
Right. Have a great night, everyone, and we'll see you soon. Bye.
Bye.